lives of everyone in this country. We appreciate that they are very significant, and I understand that people will be concerned. But we have come to the view that they are necessary to save lives and to stop this disease. First, based on the updated scientific advice, we are today advising that if you or anyone in your home has a high temperature or a new and continuous cough, then you should stay at home for 14 days. If at all possible, you should not go out even to buy food and essentials. Instead, you should ask others for assistance with your daily necessities. The exception to this is for exercise. Even then, you should keep at a safe distance from others. If it's not possible to receive deliveries at home, then you should do what you can to limit your social contact when you leave the house to get supplies. Even if you or anyone in your household don't have symptoms, there is more that we have to ask of you. Today, we're advising people against all unnecessary social contact with others and all unnecessary travel. We need people to start working from home if they possibly can. We should steer clear of pubs, clubs, cinemas, and restaurants. We should only use the NHS when we really need to. This advice is directed at everyone, but it's especially important for the over 70s, for pregnant women, and for those with some health conditions. It's especially true of London, which the evidence suggests is several weeks ahead of the rest of the country. These measures will be disruptive, but they will save lives. In a few days' time, by this coming weekend, we will need to go even further to ensure that those with the most serious health conditions are largely shielded from social contact for around 12 weeks. We want to ensure that this period of maximum shielding coincides with the peak of maximum transmission. And while the risks of transmission at mass gatherings such as sporting events are relatively low, from tomorrow we will be withdrawing our support for mass gatherings. This will free up critical workers we need to deal with the emergency and ensure a consistent approach to social contact. Second, we're increasing our testing capabilities yet further. The UK has tested more people than almost any other major economy outside of China, South Korea, and Italy. We've already increased the number of tests to 5,000 a day, and this is now on its way to 10,000 and then radically further. Third, we are boosting the NHS. Ventilation is mission critical to treating this disease, and we've been buying up ventilation equipment since the start of the crisis. But we need more, and today the Prime Minister hosted a call with the nation's advanced manufacturers, asking them to join a national effort to produce the ventilators we need. We've set up a dedicated team to do this, and we're hugely encouraged by the scale of the response so far. Later today, the NHS itself will set out the very significant steps it is taking to prepare. Fourth, Mr. Speaker, on Thursday, we will introduce to the House the Coronavirus Emergency Bill. This bill will give us the powers to keep essential services running at a time when large parts of the workforce may be off sick. Some of these measures will be very significant and a departure from the way that we do things in peacetime. These are strictly temporary and proportionate to the threat we face, and I hope that many will not have to be used at all. They will only be activated on the basis of scientific advice and will only be in place for as long as clinically necessary. Finally, of course, we're ramping up our communications efforts so that people know what steps they need to take to protect themselves, others, and the NHS. Mr. Speaker, tackling coronavirus is a national effort, and everyone has their part to play. The more people follow the public health advice, the less need to bring in draconian actions that I'm keen to avoid. And of course, we mustn't forget the simple things that we can all do. Washing your hands, following the public health advice if you have symptoms, looking out for the most vulnerable in the community. Mr. Speaker, the measures that I've just outlined are unprecedented in peacetime. We will fight this virus with everything we've got. We are in a war against an invisible killer, and we've got to do everything we can to stop it. and I commend this statement to the House.
Jonathan Ashworth.
I'm grateful, Mr. Speaker. And can I thank the Secretary of State for keeping me informed of developments. Our thoughts must be with the loved ones of those who have sadly died from the virus, including the family of the man who died at the Leicester Royal Infirmary in my constituency over the weekend. Can I, Mr. Speaker, pay tribute to all our NHS staff, our social care staff, and indeed all who work in public services. Never have we been more in their debt and will be in the coming weeks. The public, as indeed all members of this House, want to see the national effort succeed. Every one of our constituents wants to do the right thing for their loved ones, for their neighbours, and for themselves. This virus spreads rapidly. It exploits ambivalence. It demands clarity of purpose, and it demands government effort like we have never seen before in peacetime. With that in mind, can I put a number of questions to the Secretary of State, which I trust he accepts are raised in a constructive spirit? Now, specifically on today's measures, which we endorse. If we are asking people to work from home if they can, what is the advice to those who are not able to work from home because of their occupation? Millions who work in the retail sector, for example. Secondly, today the government will be asking the elderly and those with long-term conditions to shield themselves from the weekend. Could he give us more details of how this would work in practice? Will they be able to exercise, go for a walk, for example? What happens if someone refuses to follow the advice? How will those who need social care support get the care they need? What protections are in place for social care staff embarking upon regular 15-minute visits? How will those with complex needs and disabilities be supported? We know that those with comorbidities and a compromised immune system are also vulnerable. What specific advice is there for those with conditions like diabetes, hypertension, COPD, asthma, cardiovascular issues, conditions which the emerging literature shows are particularly vulnerable at the moment? How will those people get their access to repeat prescriptions, for example? I understand the gravity of the situation. Could the Secretary of State update the House on how far away from the peak he now thinks we are? And while I understand the reasoning for the decisions he has made today or the government have made, surely there will now come a moment when schools will close. Teachers are already anxious. Parents need to plan. Can he offer parents some advice who will be worried tonight? Throughout this outbreak, we have been at one in agreeing that all decisions must be based on science and evidence. But the Secretary of State, of course, will know and understand that different scientists can reach different conclusions, even when presented with the same data and evidence. So does he agree that all the evidence informing the UK strategy must be transparent, the modelling published, and the evidence base published, so it can be peer-reviewed and stress-tested? This is about maintaining public confidence. Can I just press him on the controversy, if I may put it like that, of recent days with the debate about so-called herd immunity? The Secretary of State said yesterday herd immunity is not the goal. The Chief Scientific Advisor slightly suggested something different on Thursday. If he could clarify the position of the government, but could he also clarify, because this is being repeatedly raised by our constituents, and I hope he appreciates the way in which we're putting these points to him. Many of our constituents are asking us why the UK has hitherto seemed to have taken a different course from other nations. They've suggested that other nations have been deliberately trying to delay to buy time and prepare for future outbreaks. And in that respect, could he explain why the government has rejected, or if it hasn't rejected, what lessons it has learned from countries such as Singapore, Taiwan, South Korea, who have brought the virus under relative control through containment policies? And what lessons can we learn from Germany and Scandinavia all of which in recent days, according to the data, are reporting death rates of less than 3 per 1,000 COVID cases, whereas the UK and France, it is much higher. Can I press in on the advice of the World Health Organization? They have been clear. Testing and contact tracing should continue. Many of our constituents are asking us, surely we need community testing to continue because we need to know the percentage of the population infected at any one time. Otherwise, the percentage of immunity would be unknown. And people who are ill, especially those who work in the NHS, in the care sector, or indeed anyone who is caring for elderly relatives, will surely want to know their COVID-19 status because it will impact on how they interact with other people in the community. I mean, NHS staff, Mr. Speaker, are being asked to care for COVID-19 patients, not knowing if they themselves are transmitting the virus, or if they get ill, will they now be asked to stay at home for 14 days? Surely if we can test those NHS staff and they get a negative return, we can get them back on the front line sooner. Is the issue around testing around capacity? Because if it is, has the Secretary of State considered demanding that UK-based pharmaceutical companies hand us their labs? Can we use the testing labs in higher education institutions and universities? Can diagnostic kit makers be urged to manufacture more testing kits urgently? And on the issue of a vaccine, which we understand the issues, the timescales involved, but can he confirm that he'll be approving funding for the scale-up of manufacturing of the vaccine candidates that are being developed in the UK? And on antivirals, clinical trials on repurposing drugs are underway across the globe. Can he provide a written statement to the House on what capacity the UK has to assist in this process? Turning quickly to the capacity of the National Health Service. Our NHS and social care staff need support. They need quality PPE equipment, whether in secondary care or primary care. And on the issue of ICU beds, can he tell us how many additional ones have been opened? I think he's hinted that non-emergency elective treatments will now be suspended. Could he confirm that? Members have long asked him about ventilators. Can he just outline the latest numbers and where he thinks we would be by perhaps this time next week? Can he update us on ecmo bed capacity and whether he's increasing the availability of non-invasive ventilation like BiPAP as well? And can I say to him, if we need beds and equipment from the private sector organisations, we should requisition that equipment, not pay for it. Finally, Mr. Speaker, we will cooperate with the government on the proposed emergency legislation, and I'm grateful for the discussions we have had. But the biggest challenge to the public health social distancing measures will not be boredom and fatigue, it will be finances and affordability. The poorest who struggle to pay the rent, those who worry about putting food on their table, those who have no savings to dip into, will be faced with impossible choices between hardship or health. From sick pay and lost earnings protection to universal credit changes to rent and mortgage payment deferrals, we need a package of financial support, and we look forward to working with him on that front. But, Mr. Speaker, these are indeed serious times. Many of our constituents are anxious and want as much certainty as possible. We have put these questions to him because the health and safety of the nation must always come first.
Thank you very much, Mr. Speaker. And can I commend the Shadow Secretary of State for the tone that he has taken throughout this crisis. And he rightly asks questions which I'll seek to address each and every one of them. But just before I do, I'll repeat something that I've said to this House a few times, which is that we welcome the questioning of the approach because we constantly want to be looking for the very best solution for this nation and the very best way through this that protects life. And so I would rather have, in the tone that he's brought them, the questions from all around this House so that we can try to ensure we're constantly doing the best we possibly can. And that goes for publishing the science and the modelling, which we absolutely will do, because the very best science is done in the open. He asked about the NHS being prepared. And I would say that I'm thankful that we have the NHS all of the time, but in a crisis like this, I'm doubly thankful. because we are reliant on those who work in the NHS, and thanks to the NHS, we are as well prepared as any nation can be, and by some measures, the best prepared for this stage of the spread of a virus. But what matters is giving the NHS all the support that it needs, and especially turning the capacity of the NHS to be able to address with the symptoms and the consequences of this particular virus, which is around ventilation and oxygen supply, as he says. So we are increasing the number of ventilators. We've been buying ventilators for several weeks now, but we also need to manufacture more. And as we've discussed in the House, there is no limit to our appetite to buy ventilators, and there should be no limit to the capacity, to the appetite of industry to make them, because around the world, everybody is trying to increase their ventilator capacity. As he knows, we have ensured that we can use all hospital capabilities in this country, public or private, and bring that to the task. We're expanding the use and the production of PPE and making sure we get PPE to every single different part of the NHS is absolutely vital. We will be cancelling or postponing non-time sensitive elective surgery, and the NHS will make a statement about this later today. We're increasing the ICU bed capacity, but I just want to make sure that the House understands we do not need a generic type of intensive care capacity. Of course we need intensive care capacity, and we need very specific intensive care capacity that can do the ventilation that is needed in many of these cases. Turning to the other questions asked by the honourable gentleman, he asked, what if you can't work from home? And the answer is that if you are healthy and if you're not being asked to isolate because a member of your household or you have symptoms of the virus, then of course you should still go to work. It's important that this country keeps moving as much as we possibly can within the limits of the advice that we have given. He asked about shielding and about the elderly. The policy of shielding is specifically about reducing contact for the most vulnerable. And for those who have significant health conditions, the NHS will be in contact with you over the next week. We'll publish a list of those conditions, and if you think you should have been contacted and you haven't, by next week, then get in contact with the NHS. The shielding policy starts later than its general household isolation policy and the general advice to reduce social contact. And the reason it does is because the reduction in contact that we need to see for those who we're shielding is much more significant, and we need to see that last for a significant period of time of around 12 weeks. He asked about those who refuse to follow advice. I don't think many people will refuse to follow advice. Of course, we have powers, and there's powers proposed in the bill, should we need to take further action, but I hope and expect that that won't be needed. He also asked about schools. Now, of course, the advice, the scientific advice on schools is not only that closing schools has a significant impact on people's ability to work, especially including in key areas like the health service, but also that if we get it wrong, then children, instead of going to school, might stay with elderly grandparents and therefore increase the risk. But we keep this matter under review, and it's something that we are in constant discussion about. But we haven't changed the advice on schools today. He also asked about other countries. Of course, we're constantly looking to all other countries around the world to see what we can learn about how we can do things better, including South Korea and Singapore that he mentioned. The reason that we're taking these measures at a different time to other European countries is because we are behind them in terms of the progress of the virus, which is a good thing. We're in fact, as the Chief Scientific Advisor has set out, taking these actions earlier in the curve than France and Germany, for instance, did, but behind in time because they are further advanced in the progress of the virus. He asked about testing. This is very important. Of course, people want to know their COVID-19 status. We're expanding testing as fast as we possibly can. And the test that the world is looking for is the test that can check whether you have the antibodies because you have had coronavirus. Because then we can find out not just testing of people whilst they have coronavirus, but afterwards if they have had it and therefore have the antibodies with the immunity that comes from that. That test is not yet in existence, but we are putting enormous amounts of effort into creating it. We also need testing that can be done at the bedside rather than in the lab, and there's a huge amount of work underway to bring that to bear. The same goes for vaccines, of course, and antivirals, which he asked for a written ministerial statement about, which I will, of course, ensure is provided to the House. Finally, he asked about a package of financial support. We put in place a very significant package of financial support at the budget last week, and I had a meeting with the honourable gentleman earlier today about what further might be needed.
Peter Bottomley.
I'd say there are many young people in my constituency, but when I first was chosen, we had the highest proportion of people above retirement age in the country, most of whom are economically active, and those who aren't are often volunteers. I want to pay tribute to those over 70 who are helping people even older than themselves. Can I put 3 quick points to the Secretary of State while welcoming all the points he's made so far? And he doesn't need to answer them in detail now. The first is that senior general practitioners are worried that some medicines, controlled drugs, which are safe, are being destroyed because the patient for whom they were first ordered may have died. Morphine and the like. The shortage, if that comes, will lead to distress and agony for people unnecessarily. So could the Secretary of State look into that and see whether whatever the requirements are might be lifted during this period? The second is that the advice to reduce social contact may be right and important, but if people are fit and healthy, and if they're running a business, to have their business closed down just because they've hit a certain age doesn't seem necessarily right. And can I add to one of the points made sensibly by the spokesman for the opposition, which is that there's some help for people with mortgages, but many people who will lose their jobs are paying rent. And could you make sure that people are not unnecessarily evicted or threatened during a short-term period of shortage of money?
Thank you very much, Mr. Speaker. The measures on shielding are specifically for those who have significant health conditions and will be contacted by the NHS. They are not for the generality of over 70s who are healthy, for whom the guidance is the same as for people of working age, except that we insist that we strongly advise as opposed to advise it. And that is for their own protection, because the over 70s and especially the over 80s are at higher risk, significantly higher risk of mortality, of dying from this virus. The other points he made are welcome. He makes a very important point on rent, and this was part of the discussions that we had earlier today, and I've been talking to the Treasury and the Welfare Secretary about it. Action has already been taken by many banks on mortgages, and the point he made about the availability of drugs is, of course, critical. We have a very, very comprehensive drug supply chain system that we understand well, thanks to the planning that we've done over the last couple of years. And we thus far have not seen shortages outside of those that already pre-existed this virus that we were debating in the autumn, for instance, over HRT. And of course, we keep that under constant review.
Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. The Secretary of State will be aware of the concern as to why the UK government's approach had been such an outlier up till now, including the talk about herd immunity, when it's not clear that actually any immunity from this virus is long-term. The UK is now facing an exponential rise, and I therefore welcome the UK government decreasing all non-essential contact, as I think it is critical to slow down and limit the spread of this. He talked about, or indeed the briefing from the Prime Minister talked about not providing emergency services to large gatherings, But can he clarify whether the government are advising against or forbidding mass gatherings? I welcome the talk about increasing testing capability, but the briefing talked about only testing those in hospital and key workers. In Scotland, surveillance testing, which is in practices that monitor disease in the community, is continuing. Will that also be the case here in England? After the confusion over the weekend, and indeed the comments he's just made about healthy people over 70, can he clarify what the advice is for people over 70 who live in their own homes or live in care homes? Exactly. Are they meant to be staying at home, or are they simply meant to be decreasing contact? In particular, is he discussing with social care providers to lengthen the time of each visit so that there is time for the care worker to take precautions? He says the healthy should go to work, but what if they work in a club? What about socially vulnerable, like homeless, or those who have no recourse to public funds, like refugees or asylum seekers? What provisions being put there? We on these benches welcome the measures in the budget, but when will the devolved governments know exactly how much funding they will have to mitigate the economic impact of this in the 3 devolved nations? And finally, what further changes will be carried out in the Houses of Parliament to ensure that core services continue without increasing the risk, particularly to older members of both houses?
Thank you very much, Mr. Speaker. We do not support mass gatherings. We've made clear that we do not support. We have advised against unnecessary social contact, so it goes without saying that we do not support mass gatherings. She asked about surveillance testing. We have in the UK, across the UK, one of the biggest surveillance operations in the world of coronavirus. Of course, it happens in Scotland, but it happens right across the UK. She asked also about Parliament. And, Mr. Speaker, I understand that you've been having discussions today about how Parliament will operate, but I think that the whole House will be sure in our collective decision that Parliament, although it may have to operate differently, must remain open.
Speaker, may I join with the Secretary of State and the Shadow Secretary of State in commending all those and paying tribute to all those who work within our National Health Service, upon whom we rely day to day, but rely all the more so under these conditions. Can I say to the Secretary of State, if I may press him on 2 points that have been raised by others, but the World Health Organization advice was very clear: test, test, test. At an earlier stage, the UK changed its testing requirements, and those who have symptoms and self-isolate are no longer tested. If the full information is to be available, surely the testing has to be very significantly increased. Who exactly is going to be tested? And one of the difficulties, I think, has been the information, the way the information has been presented. And so that we see, just to pick up the point that the spokesman from the SNP made about the over 70s, but it was echoed elsewhere. The headlines are that over 70s, even now, that over 70s are going to have to stay at home for 12 weeks. Can the Secretary of State be absolutely precise as to what the advice is for over 70s and those with other conditions and what those conditions are? Yeah. And then finally, this question of 7 days or 14 days self-isolation. My understanding was that if you had symptoms, you should and were on your own, you should self-isolate for 7 days. Yeah. But if you were in a family, the whole family should self-isolate for 14 days. Perhaps he could confirm.
Thank you very much, Mr. Speaker. My right honourable friend is precisely correct on that and the third of those questions. The difference between the advice for 7 days and 14 is precisely as follows: that if you have symptoms yourself, if you live on your own, then you should self-isolate for 7 days. But if you live in a household with others, then the whole household now needs to stay at home for 14 days. The reason for this is that if you live in a household with somebody who has coronavirus, it is highly likely that you will catch it. And therefore, it's important to protect from the onward transmission that everybody stays at home. That's the reason for the distinction between the 7 days and the 14 days, and I hope that's clear. 7 days for individuals, 14 for households. On the point about the World Health Organization saying that we should test, I wholeheartely agree. And we have continued the increase in testing in this country throughout this outbreak. The point that was made last week is that as the increase in number of cases continues, so that our increase in testing capability must increase faster, and therefore at this stage we have to make sure that the use of the tests we have are prioritised, and as we expand testing capability, so we will expand out the number of people who can get hold of those tests. I understand the frustrations. I understand the frustrations of those who want a test, but I'm sure that the whole House will agree that we've got to make sure that we use those tests on the people who need them most, and that means saving lives in hospitals. On the point about the over 70s, again, to reiterate the answer I gave just a moment ago, the advice to everybody is to avoid unnecessary social contact. For the over 70s, for their own protection, that is strongly advised. And the shielding, which is essentially reducing as low as possible all contact, is for those who have underlying health conditions and will be contacted by the NHS. The precise details of all of these will be published on the gov.uk website so that everybody can see not only the answers to the question which I'm giving, but can see the precise wording of what we expect everybody to do, as I've set out in the statement.
Miliband.
Thank you, Mr. Speaker. Can I say to the Secretary of State that this House has always come together at times of national crisis as one, and this is the spirit across the House today. In that spirit, can I ask him to match the unprecedented public health measures he has announced today with unprecedented economic measures to support all of the businesses, large and small, their workers, the self-employed, who will be affected by the measures announced today. And we've seen across the world, for example, in Denmark, workers' wages being guaranteed by a combination of government and employers. And it is no fault of the Chancellor of the Exchequer that his budget was last Wednesday and is now out of date. But can I use the Secretary of State to urge him to come back to the House with economic measures that match the gravity of the moment?
I absolutely understand the point that the Right Honourable Member is making, and he's right to make it. Of course, these are matters for the Chancellor of the Exchequer rather than me. There was a G7 call today, which the Prime Minister participated in which economic considerations like this were considered. But the final thing I'd say is, Mr. Speaker, every single one of us in this House will have businesses in our constituencies that are already facing the brunt of this virus. And we saw from the collapse of Flybe right at the start, what feels like weeks ago now, the very significant economic consequences, and we have our eyes wide open to those.
Thank you, Mr. Speaker. Can I warmly welcome the measures announced today? People have debated when these were going to be introduced, but the government has today shown it has the courage to introduce very tough measures which will have profound economic consequences, and that will reassure many people up and down the country. In the constructive spirit of the Shadow Health Secretary, I just want to ask a couple of things about the measures that were introduced. Firstly, he is advising people not to go to clubs, cinemas and restaurants. Will he also advise clubs, cinemas and restaurants to close their doors so there is absolute clarity that people should not at this moment be engaging in these activities? Secondly, if someone in a household is symptomatic, he is advising the whole household to self-isolate for 14 days. I understand the logic behind that, which was very clearly explained, but the World Health Organization advice is to test and isolate every single suspected case of the virus. So could he just explain why there is that divergence? And thirdly, just to follow up the question asked by my right honourable friend, the Prime Minister, former Prime Minister, Is the
Unprecedented times.
is the advice to healthy over 70s who do not have an existing long-term condition that they should be part of the new shielding policy that is happening at the weekend, or is that shielding policy just for over 70s with an existing health condition?
Mr. Speaker, on that last point, no, the shielding policy is only for those with existing health conditions, and those who we're going to ask to participate in shielding from next week will receive a contact from the NHS, and we'll publish the list of conditions that we consider necessary for shielding. On the point he makes about testing and isolating, I strongly agree with the World Health Organization about the need for testing. And I spoke at the weekend to Dr. Tedros, the head of the World Health Organization, and we strongly agree on the need for testing. The question is, how fast can you ramp up testing capability when the tests that we need, which are the blood tests to know who has had coronavirus, and the bedside test or the home test, so that these tests can be expanded rapidly across the whole country. The first of those is yet to be invented, although we hope that it is fairly soon. The second of those has just been invented in the last few days, and we're in intense negotiations about rolling those out very rapidly here.
To Hussein Ali Khan.
Thank you, Mr. Speaker. Today I bring a message from my colleagues who are working so hard on the NHS front line. They say that they don't have the protective equipment that they need, nor do they have the capacity to manage the spread of infection in their own departments. There is clear concern from hospital staff and the wider public alike about the transparency of the plan to tackle the virus. Does the Secretary of State agree with me that our incredible staff must immediately have the protective equipment they need to be safe, that they should be tested if they show symptoms of virus infection, as currently not all of them are being told that they can, and that more information must be transparent so that medical teams across the country can prepare their departments for the very worst?
The whole of our action plan is based on the science and on as much transparency as possible, and we have exhibited unprecedented transparency in this crisis so far, and I pledge again to full transparency, publishing, for instance, the modelling that underpins the scientific advice, and also publishing the action plan 2 weeks ago, that at the time felt like we were looking at some things that were quite out of the ordinary, and I don't think anybody then anticipated that we would be having to bring them in the way we have, and many countries around the world have now brought in. So I pledge once again to that transparency. She's completely right about PPE, and we need to expand the amount of PPE. We are, again, buying that, like ventilators, as fast as we possibly can. And part of our call for this national effort to manufacture also includes for PPE. And I just want to finish my answer to the Honourable Lady, Mr. Speaker, by saying something about those who work in the NHS. Because the NHS is going to face an extraordinary time, and many people are going to do extraordinary things, but it is going to be very, very difficult. And I pay tribute in advance to the service that every single person who works in the NHS is going to give. She says staff testing from a sedentary position. She's right to remind me of that part of the question. Of course, we want as much staff testing as soon as possible. We're using the testing capacity that we have to save lives, and saving lives includes saving lives of the medics.
Steve Bryan.
Mr. Speaker, in the last 24 hours or so, I've spoken to a great number of the head teachers in my constituency. I think it's fair summary to say that there is support for the decision to keep schools open, and I agree with them. However, there is great concern that no matter what we might want to do, an increasing number of teaching staff who are becoming unwell themselves and therefore not able to be in school might end up forcing the issue and leave heads in an impossible position. So if we're to avoid that, can I ask the Secretary of State, and I feel slightly guilty asking this because he is the Health Secretary, but this is the statement that we have today, what is the government view on relaxing the student-staff ratio, on getting Ofsted off schools' backs now, please, And if we were to move to a skeleton service in schools to allow key workers to keep working, how are we to define key workers given that we are in the middle of a national crisis?
Yes, we're looking at all of those points. The proposals to relax student-staff ratios is in the bill, and we'll be publishing the content of the bill tomorrow and the bill itself on Thursday. The point that he makes about key workers is incredibly important, and I'm working hard with my right honourable friend, the Education Secretary, to address exactly the sorts of concerns that he raises, because, of course, schools play an incredibly important part, not just in educating our children, but in allowing so many people to go to work. But we've got to make sure that they're safe as well. One of the blessings of this virus, Mr. Speaker, is that it spares children in almost entirely, and that means that it is safe for children to go to school.
Ms Kendall.
Could the Health Secretary give some reassurance to the public about his plans for social care, which many vulnerable elderly and disabled people rely on? In particular, what plans he has to ensure that the care workforce can effectively continue. We've got over 120,000 vacancies already in this area, and half of all home care workers are on 0 hours contracts. Yeah. Is he confident that the care workforce can do what elderly and disabled people and the NHS need?
It's obviously an incredibly important area. There was a call with local authority leaders and my right honourable friend, the Community Secretary, and the Care Minister earlier today. It's an area of enormous amounts of work, and we will do everything we can to support social care.
Dr Luke Evans.
Thanks, Mr. Speaker. And can I congratulate both the Secretary of State and indeed the Secretary of State, Shadow Secretary of State, of their tone in this debate. One of the questions that I'd like to ask is particularly around most people will inevitably get infected. Most people will recover. Could he tell us when those people can recover and return to work and what the impact will be on that?
Yes, most people tend to recover within the 7-day period from getting first symptoms. Most people, not all, and many become very ill. But for most people, this is a mild to moderate illness. And once they've recovered, the vast majority of the evidence is that the illness does not come back for some time. But of course, all of this evidence is kept constantly under review.
Neera Wilson.
Thank you, Mr. Speaker. Would the Secretary of State clarify some details?